That's probably the most common question that we get asked in the Mohs Surgery facility or by our cancer patients. And the regrettable answer is yes, it's highly likely. These cancers are non-melanoma skin cancers primarily, develop often because of two features. One is the sensitivity of one's skin, in other words, how fair one's skin is, and the amount of sunshine that skin has then had over a patient's lifetime. So those two factors, fairness or susceptibility of the skin and sunshine, ultimately combine together to result in the development of a cancer. The sunshine itself imparts DNA damage to the cells, and eventually certain cells fail, developing into a tumor. Now, if a patient develops a cancer like a basal cell cancer, they've got about a 40 to 50% chance of having another similar tumor sometime within the next 5 years. Now, that shocks a lot of patients, but in reality, when you step back and think about it, it's not so absurd to think about it, because if you've had enough sunshine on your right cheek to develop a cancer, why didn't you get one on your left cheek? Unless you had that covered completely through your lifetime, which you probably wouldn't. The other cheek would have had just as much sunshine. It's for this reason, when a patient comes in and has had cancer treated on one location of their body, let's say on the left side of their nose, and if 3 years later they develop a cancer on the right side, some patients will want to know whether or not this cancer is jumping around or extending. Is this a recurrence of the original tumor? It would be exceptionally rare. These cancers typically are focal, and if the cancer develops, let's say, on the other side of the nose, it's a new tumor typically.